Welcome to a world where particles, vibrations, and light collide, a place where leading industry experts and healers come together to discuss controversial topics that will challenge your beliefs and expand your mind. From quantum physics to metaphysics, no topic is off limits, but this is not your typical podcast.
Always be in your integrity, and in your integrity you understand that it is what it is. Energy is until it's not, right? Energy's flowing into your body until it stops flowing because it becomes so clogged up, and then disease begins, right? So be in your integrity. When somebody's saying something that you totally disagree with, don't sit in your mind and go, what an idiot, right? Just say, wow, they're really convicted on how they feel. That's amazing. Bless them in their thoughts. Don't be judgmental in their thoughts. Bless them for having the power to feel the way they feel, even if it's different from you.
It's a show guaranteed to make you question your assumptions and push you to expand your horizons. For those who are already fascinated or passionate about the work of Patti Conklin, this show will give you an inside look into the mind of one of the industry's most renowned figures in vibrational mediation. With over 28 years of experience and a long list of big-name collaborations, Patti's insights and perspectives will inspire and challenge even the most seasoned practitioners. And if you're the skeptic who doesn't believe in vibrational mediation, this show is for you. Healers, doctors, and scientists are just a few of the professions represented by our fascinating visitors that bring their unique perspective to every episode. Join us on this journey into the world of healing within and adventure inside. Our mission is to inspire, challenge, and enlighten our audience with thought-provoking conversations and fascinating guests from a wide range of fields who can shed new light on important issues facing society today. Join us for each episode if you're ready to explore and learn about the latest developments at the intersection of cutting-edge science, spirituality, and self-improvement. Enter a world where waves, particles, and light all meet. Enter the world of healing within and adventure inside.
Hi everyone, this is Patti Conklin. Thank you so much for joining me on Healing Within and Adventure Inside. There's so much of life that we get to explore and deal with and challenge with and love with and joy with and all sorts of things, but it's all an adventure, and we hit so many different milestones every day, every year. And we have different circumstances that come up in our life that we need to look at and not necessarily deal with. I'm not sure that that's the right term, but that we need to be responsible for because our life is ours and we have the responsibility to take care of it. We've been discussing COVID in earlier segments, and I encourage you to go look at segment 1 on COVID. But I'm going to continue our talk here with Dr. Frenesa Hall, good friend and awesome MD, wonderful musician, by the way. She has rocked the halls for years. So she's multi-talented, multi-versed, and she's my go-to person. You know, I've been her go-to person a few times.
Absolutely.
So we've had a good balance of this, but you know, it's wonderful to have someone like Frenesa who is trained in Western medicine and yet has a very strong holistic bent on how you look at disease and treat and so forth. And so I want to talk a little bit about the vaccines that are now getting ready at the time of this airing to be distributed around the world. So let's talk about the virus in terms of how many viruses are there that are deadly to humans?
Well, there
are transmitted.
There are many viruses that are deadly to humans. I mean, rabies virus, for instance. I mean, there's tons.
You don't have to get 20 shots in the belly anymore.
No, they have a better treatment than that. But as far as coronaviruses, there are 7 coronaviruses. 3 of them are problematic for humans. Now, there are coronaviruses that infect animals that don't infect us. So I won't even go there. But the 3 that concern us are SARS-1 and 2, which is severe acute respiratory syndrome, coronavirus, coronavirus 1. Okay, and that was from, I think, 2012, something like that, or prior to that. And then the one we're dealing with now, corona, which is the SARS-2. Okay, and it's a coronavirus. And the disease is COVID. CO for corona, VI for virus, D for disease, and 19 is for the year 2019.
Got it.
So COVID is the actual illness that we have.
Okay.
Coronavirus is the family of viruses. And then severe acute respiratory syndrome, 1 is one type of virus, and 2 is a little tweak on this virus.
Right.
So there's a lot of alphabet soup. So just understand that there's the virus and then there's COVID, which is the disease.
Is that where, when the pandemic first began, that people started going with it's a hoax, it's, we've had it forever, why are you bringing it to our attention now? Because there's a new generation, essentially, of COVID, SARS-2. Right.
So yes. So it's not the exact same virus from before, and the other one caused a pandemic. It just didn't reach us.
That's true.
Okay?
That's true.
And this one has hit our shores and has spread very rapidly all over the world.
Yeah.
And so, it has created huge challenges to the healthcare systems all over the world.
Right. Well, let's go into, it's here, it's all around the world. I don't think there's a country that hasn't been affected by it. And we're moving into a vaccine process. And we were talking earlier about the distribution, how does a vaccine work?
Ooh, okay.
How does a vaccine work? I mean, I think, certainly in my generation, I don't know when they stopped doing it, but, we've all got that little white scar here on our arm from getting smallpox
That's
shots.
what it was?
Yeah, and then it went to sugar.
5 years old.
And then it went to sugar pills. I
No,
can't help it that you're so...
polio.
That
was a long time ago, folks.
a long time ago.
I don't even remember what it was.
Polio was the sugar cube.
Yeah, polio was the sugar cube.
Thank you.
So it was smallpox. And, we were all getting that shot. We all have scars. Going back to my generation, not your generation. So
how do they work?
But how do they work? I mean, because the distribution, how it's affecting our DNA. Talk to us about that, Dr. Hall.
So when we are infected by virus or bacteria or whatever, our body naturally fights it. And our immune system turns on and creates little soldiers to go out and fight the virus. Okay. And in this case, the vaccine is stimulating the body to make the little soldiers to kill it. So instead of having an infection, which stimulates the body to make the little soldiers to fight it, we're using a vaccine to turn on our immune system to make antibodies specific to kill the virus. Okay.
Is it safe?
So, there's a lot of controversy about viruses and, vaccines and
vaccines in general.
General.
Right.
And so, and some of that has to do with different additives to the vaccine. So it's maybe in some cases not necessarily the substance of the vaccine that is turning on the immune system. It may be the preservative, for instance, that's in it. So there's lots of different aspects.
When you say a preservative, you're not talking about something that we put in our food
No,
to preserve.
different types of different things.
Okay, I just wanted
preservatives for vaccines and for drugs and things like
Got
that.
it,
So a
got
little
it.
different.
just
But-
I'm a lay person. I just need to know, what it is.
Yes, the idea is that whatever it is has to be able to last in the refrigerator or freezer for some period of time because it has to get transported, manufactured, transported, then get to the doctor's office or wherever to then get
Right,
given to the individual. So it has
Right.
to have some shelf life.
right.
So, but
Got it.
the underlying role of any vaccine is to turn on your immune system to specifically fight whatever that vaccine is for, whether it's measles, mumps, and rubella, or COVID.
Right, right. It's a lot of work that goes into those.
Yes, there's a lot of science. And, vaccines have been around, as you said, for a long time. I mean, we're, however old, and vaccines have been around since before we were born.
Did you notice, folks, how she covered her mouth when she said no matter how old we are? I think she was making a little bit of a slant this way,
Just
but
a little.
yeah,
Uh-huh. Couldn't resist.
but they have shifted and changed through the years,
Yes.
right? And so, when we look at getting our flu shot, we talked about this in a prior segment, that, they can only guesstimate what strain of flu is going to be active during that year. And best guess sometimes doesn't cut it, right?
Right. Sometimes
And-
it's really good, and sometimes it's so-so.
It's so, yeah. And so in what I've heard in terms of the distribution and implementation, that, it can be problematic in terms of shipping it and so forth. But when we look at it in terms of an individual choice,
Mhm.
like I'm going to personally have an issue. If I want to fly to France in May for my tour, and they tell me I have to have a vaccine before I can go into France or before I can get onto the airplane. I'm hoping that they will leave it into individual choices. But how do we help people understand, is it right for me to get a vaccine? Is there an easy answer to that?
There really isn't an easy answer to that. I understand that many people have concerns about a vaccine that was created so quickly. They have concerns about a vaccine that the type of vaccine has never been used in humans before. And so it's a new technology. And we're always a little apprehensive about something new. I mean, think about it. The new iPhone came out, one of them, and it was terrible,
Yeah, Right.
and people hated it. Right.
right.
And so, people, I think, have that kind of in mind, like, well, golly, this is brand new. Do I really want to be the first one getting it?
Right.
And what I say to people is we each have to come to that decision for ourselves and what our risk is. And if you are very high risk to have severe disease and have a terrible outcome, then you may want to really consider having that vaccine.
Right.
Okay. Now, if you're very low risk, then, maybe you don't. But it's really an individual thing. I don't think
Right.
it's something that can be mandated.
Right.
It's your physical body. Countries can do what they want, whether they let you in or not. So
Right.
all bets are off there. But, I understand that there are concerns. And I have concerns about, novel things. I mean, many times when new drugs would come out, I would wait and I would see how people did in the post-marketing surveillance and see, because there have been times when drugs have been recalled because they found some issues.
Yeah.
this vaccine, has been fast tracked. And so it certainly makes sense to me that people would have some apprehension. On the other hand, I think that when you look at how devastating the disease can be, if you're one of those people at risk for devastating disease, then you might want to give this serious consideration because the downside is really down.
Yeah. Yeah.
So I can't give general advice, say do this or do that. And I wouldn't do that anyway. But I think that is an individual choice. You should probably discuss it at length with your doctor, your trusted counsel,
Yeah.
and then you come to your personal decision, and recognize that this vaccine getting distributed doesn't mean, oh, we can stop doing what we've been doing.
Right. Right.
Okay. It's going to be months before it is really available to the masses.
Right.
And so in the meantime, we still need to continue just some common sense things, washing our hands, wearing masks, being mindful of how close you are to people.
Right.
I think that's just, that's just our social responsibility to protect people. I mean, back decades ago, there were laws about spitting. When I was a kid in New York City, it had a sign that said no spitting in the subway.
Yeah.
And I was scratching my head. I'm like, what on earth? Like why? Well, that was because tuberculosis was pretty prevalent. And the infection was spread from respiratory secretions. And so they didn't want people spitting, active
I'm
tuberculosis.
amazed that hasn't come out again.
Well,
I mean, we haven't seen those signs of no spitting,
Right.
right?
But I'm just saying that was a health measure to lower the spread of tuberculosis.
Yeah.
And so wearing masks is along those lines.
Yeah.
Yeah. And it's, as I said in the first part one of this, that I don't want to be responsible for making anyone ill.
Right.
Okay.
Right.
I have a 96-year-old mother-in-law who has multiple health issues. The last thing I want to do is be responsible or think I might be responsible for bringing coronavirus to her.
Right.
So if that means I have to wear a mask when I go to the grocery store or to the hardware store, so be it.
Right. Right.
That
Absolutely.
is a minor inconvenience versus the potential risk to her.
Well, and I think also looking at multi-generational homes, where you've got young children that are still in school, and run the risk of bringing it home to grandma, grandpa, of being asymptomatic and bringing it into the household. I mean, mitigating circumstances need to be looked at. I know for us as a family, I haven't seen the grandkids nearly as much as what I normally do because we have a frontline worker in the family and have little munchkins. And I am more at a higher risk, A, because of my age, don't go there, but B, because I have a long history of bronchial pneumonia every winter. And so, and people go, how do you get bronchial pneumonia every winter? I push myself too hard. I want to take the winter off. I want to take Christmas and January off. And so I overfill my schedule in the past and make it so that I'm exhausted and my immune system's toast. And so I've been much more aware this year of keeping my immune system in better shape, which also it's, we're into bronchial pneumonia stage and I haven't gotten it yet this year. So maybe we've been taking care of things. But I know within our household, even for Thanksgiving this year, we all live in the same community and we typically all get together. And this year we made the decision not to. And that's kind of rough when you're living, 10 miles away from each other,
Mhm,
but we stayed within our family units. And as a single woman, guess what? I was within my
Zoom.
single unit. But I think people really do have to pay attention as to whether or not a vaccine is going to be right for them, and go into that personal responsibility space we
Mhm.
talk about a lot.
And not just responsibility for you, but
those
your
around you.
your
Yeah.
close contacts
Your
and what
close
their
contacts.
risk is.
Yeah.
And quite frankly, you should think about that even with flu season.
Yeah.
I mean, the flu does kill around 30,000 people a
Yeah.
year.
Yeah.
And so, I wouldn't want to give the flu to my 96-year-old mother-in-law either.
Right.
And
Yeah.
so we should, you know, practice some good hygiene
Yeah.
just on a routine basis.
Yeah.
This is, taking it up a notch, but, I'd rather be safe than sorry.
Yeah.
Because sorry in this case is really
Right.
sorry.
Can really be sorry.
So, I think that it's just, it's just part of public responsibility, being members of communities, members of the nation, and pulling together, and maybe this is, overkill,
Mhm.
you know, um, but the fact of the matter remains that we have hospitals with ICUs that are at capacity.
Yeah.
Some of them are building temporary hospitals in parking lots.
Yeah. I saw that.
Okay.
Yeah.
So, it's hard to call this a farce.
Right.
And it's very hard to say this, oh, it's like the flu. Well, I've
No.
never seen the flu in spring and summer.
Right. Nor have I seen it put people in such dire straits.
To this degree.
To this degree.
Yeah.
I mean, yes.
I totally agree.
Yeah.
So, I would just urge people to err on the side of caution.
Yeah.
It's really, it's inconvenient, but, at the end of the day, if you help protect someone
Yeah.
by protecting yourself,
Right.
then, that's a life potentially saved.
Right.
And I think that that's a very reasonable thing for us to do.
Yeah. The other piece that comes into this is the people are talking a lot about having COVID fatigue,
Mm.
and just saying, I've been dealing with this for so long. I don't want to wear a mask anymore. I want to go out and have dinner and socialize and so forth. And certainly at no point do I want to invalidate how this is affecting small business and people around the world in terms of not being able to work and having their businesses closed down and so forth. I mean, the economic portion of it is absolutely devastating. But when we look at the stress that continues to pile on because of the COVID fatigue, it's really important, folks, that we pay attention to what our stress level is. We can say, well, this is our new normal. Well, if this is our new normal, then our stress level has to shift to be a new normal. Our removing stress. I'm gonna be personal here for a second because it just cracked me up. But grandson Kylan, we had dinner and just he and I, and he gets done and we get back home and get to his house, and he immediately pulls out his yoga mat and he starts doing yoga. And I said, why are you doing yoga? And he said, because it helps my digestion and I just feel calmer. And I'm like,
how old is he now?
7.
Wow. But
7.
you know what? That is a wonderful thing because it's self-care.
Self-care.
And that's what we need to focus on.
Yeah.
Taking care of ourselves and our families.
And our families.
This is a time for introspection and for us to reassess what is really important like you said, we can't negate the financial impact of
Right.
this. I can't imagine. I'm very fortunate. I work from home, um, but it does make taking care of ourselves a higher priority.
Yeah. Yeah.
And there are many things we can do to help mitigate the effects of stress. And we'll get into the effects of stress in another segment,
Right.
but it has a negative effect on the body,
Yeah.
from the immune system being suppressed to, weight and sleep, etc. And so what are those simple things that we can do to help lower the physical effects of stress?
Yeah.
Well, deep breathing exercises, meditation, there are apps for that, exercise, yoga, self-care.
Self-care. Yeah. You have to take care of yourself before you can take care of someone else. And I want you all to think about that of just, are you taking time to be relaxed? Are you taking time to have that self-care, eating appropriately, taking your supplements, and taking that moment to do that deep breathing of just, you know what, there are things I can control in this life, and there are things that I can't control in this life. And the things that I can't control in this life, I can set aside. I don't need to let it overwhelm me or overtake me, but I can take a stance in making sure that I'm doing everything I can to be healthy. And I encourage you also to sit with your body, sit quietly with your body, close your eyes, go into your body. What do I need? Do I need yoga? Do I need meditation? Do I need to exercise within the home? So many different things that we could do. I could learn how to cook. That might not be a stress relief. That may be
Not for
more
the
of a
people that are
stress
eating it.
True. So I want you to think about, folks, what's good for you, what works for you. Really sit quietly. Is a vaccine going to be appropriate for you and those around you? And really look at how life is going to be. And at some point we're going to whoosh through this. But until that point, take care of yourself. So thank you so much, Dr. Hall, for joining me. And it's Patti Conklin, Healing Within, an Adventure Inside. So thankful you're joining us. We'll see you again next time.